Twila, National Patient ID. This is getting closer to reality. Tell us a little bit about that.
So back in 1996, when HIPAA, the law, was passed, it included a requirement that the federal government issue everyone a national patient identification number. Several years after that, Congressman Ron Paul put a kibosh on the whole business by putting into law that it could not be funded and they could not have discussions about it. So they couldn't get together and have meetings and that sort of thing. But now, some groups, like a group called CHIME, it's really a group of healthcare or health information executives, and some hospitals and others are saying the only way that we can have an interoperable national health information system is if everybody has a unique patient identification number. So, or some unique way of identifying everyone. So this push, which had been languishing for a long time after Congressman Paul said there could be no money, is now back on, and there are letters going into Congress asking Congress to require a national patient identifier and to have the federal government issue it so that they can connect everybody's medical records together in this national medical record system that they're building.
So we're going to go to the doctor, and they're going to say, hey, we don't have your national ID number. What is it? We'll have to give it to them. And is there anything that is going to exempt us from that? Is there anything we can say? Will we have the right to say, no, I don't want a national ID number. I don't want my records exposed to the government. Are we going to have any rights there?
Well, so to be clear, there is no legislation to undo what Congressman Paul did. Okay. There are just these groups who are now starting to push Congress, telling them to do this. Now, if Congress actually did such a thing, which I think would put them all in trouble with lots of people, given where we are with surveillance in this country, given where all the breaches are, given the fact that China has accessed all this data on federal employees and all this data on anyone in Anthem, the Anthem insurance company, the idea that the government would create a national patient identifier, making it easier for China and Russia and everybody else who wants all this data on us to do that, I think it would be difficult for them. The pressure is on, but as of yet, I don't see that happening. I know there's some angst on the parts of those who want this to happen, that it's not included in the HHS budget bill in the Senate, and when they were hoping that it would be, and it isn't. I think it would be a national brouhaha if that is actually found in there. So we helped to stop it back in 1998 at the only federal hearing in Chicago. I testified, and the New York Times put it on their front page, and the next year, Congressman Paul put a kibosh on it.
So
and it never went anywhere.
What's the motive for the real motive, the underlying motive?
Well, the real motive, I think the real motive is that this is the only way that they can build a national medical record system, is to give everyone this unique identifier. They can't use the Social Security number because there are so many Social Security numbers that are inaccurate, or there are duplicates of them. There are just problems with the Social Security number, so they wanted to have another one. Of course, any identifier is going to end up with this problem. But the real reason is everybody who looks at our data as a gold mine for their own agendas, which include everything from being able to get research grants to being able to deny access to health care, to controlling how the doctor practices medicine, to building brand new bureaucracies. For all of these kind of agendas, the more data that they can have, the more they can keep their jobs, their businesses, their profits alive.
Wow. Well, that's something we're just going to have to track and follow, I guess, as it happens.
Yes.
I guess the idea is right now that we've got to hope that somehow in the Senate bill that this doesn't slip in there
And I would just encourage your listeners to contact their members of the House and the Senate and talk about this, because I have been in Congress when these calls come in. I listen to the staffers as I'm sitting waiting to have a meeting, and they get these calls and they have conversations and they write notes and they give these notes to their members. So, I would just encourage your listeners to just put a bug in their ear saying, I'm watching this issue. I'm watching this issue, so that it comes up on their radar screen from their constituents.
Yeah, good advice. And we need to do that.